Get ready for the Health and Wealth Expo Live Summit, May 15th and 16th in New Jersey. Learn how nurses are building six-figure businesses and prioritizing wellness. Register now at healthandwealthexpolive.com. We are gearing up for the Nurse Shift Change Rally happening on May 24th. So make sure you report for duty. Report for duty at a city near you. We have a LinkedIn page. We have an Instagram page. I think we're on Blue Sky, social media, you name it. We're going to be in cities like Seattle. Seattle's been added. Atlanta is going to be in the building. Let me tell you, Atlanta showed up. We were in a meeting the other day in Atlanta. It sounds like Atlanta is showing up. We're going to be in DC, California, Connecticut, to give you an understanding of why we're marching and why we're even organizing this rally. So things like that, drug costs, like how are we being affected? How are our marginalized communities being affected, or our underrepresented communities being affected by these type of implementations? So this is why it's important, because it could be your mom, it could be you, it could be your parents, it could be your kids. Nurses need to be in the room, right? So why nurses and healthcare professionals really can't afford to miss this summit. It talks about burnout. It talks about financial literacy. And let me go ahead and read it because I said I would. I mean, we're the backbone, right, of the profession. And welcome to Nurses with Voices. I'm Dr. Lendra, your host and fellow nurse who's traded in burnout for breakthroughs. I'm here to show you how to transform your nursing career into one filled with purpose, reduced stress, and incredible opportunities. Whether you're looking to start your own business, build generational wealth, or simply find a healthier role in nursing, this podcast is for you. Join me to explore practical strategies to overcome burnout, combat bias, and chart new paths in nursing. It's time to reclaim your voice and reimagine your future in healthcare. Let's get started. Welcome back to another episode of Nurses with Voices. I'm Dr. Lendra. And, I want to start off today by saying kudos to Governor Phil Murphy for making May a Nurses Month. So nurses get a Nurses Week, right? We get a Nurses Week every year, May 6th through the 12th. Well, I think sometimes it may alternate, but we get a Nurses Week, right? Let's just say that the days may change is what I'm trying to say. We get a Nurses Week, but Governor Phil Murphy has declared May as Nurses Month. He signed a proclamation this past week, making May Nurses Month. So kudos to Governor Phil Murphy. And, this is something that we deserve as nurses. I think what we do is very admirable. What we do is very inspiring. Our purpose is essential. No nurses means no healthcare, from the words of Dr. Lindsay Harris. The reason I mention this is because we're the most trusted profession, but we're arguably not always the most respected profession, for a number of reasons and for a number of variables. So when something like this takes place, it's something to really be honored. Thank you to Governor Phil Murphy. And we are gearing up for the Nurse Shift Change Rally happening on May 24th. So make sure you report for duty. Report for duty at a city near you. We have a LinkedIn page. We have an Instagram page. I think we're on Blue Sky, social media, you name it. We're going to be in cities like Seattle. Seattle's been added. Atlanta is going to be in the building. Let me tell you, Atlanta showed up. We were in a meeting the other day in Atlanta. It sounds like Atlanta is showing up. We're going to be in DC, California, Connecticut. Listen, we are making this really a nationwide approach to humanities, ethics, social justice, the sciences, because they're all under attack. And this is our way of standing up for what we believe in. And we ask that you stand with us. If you're a nurse or healthcare professional, whether you're a CNA, LPN, nurse practitioner, registered nurse, if you are a nurse or healthcare professional, we ask that you stand with us in solidarity, because this movement is very important. And this is only the beginning, which is why I call it a movement. And when we talk about movements, we're going to talk about the Health and Wealth Expo live summit that's taking place. But before I get there, I really want to just make sure that you guys understand why these movements are so important, whether it's the Nurse Shift Change Rally, whether it's the Health and Wealth Expo, or whether you're just getting around the right networks or being in the right room so that your voice can be heard, hence nurses with voices, right? So that your voice can be heard and that you can have such an impact on the profession and on the community. And speaking of community, when we talk about health, so my mother was recently hospitalized. She had to have her pacemaker wire changed. So not only did she need to get the battery changed, one of the wires was no longer functioning. She had to get the wire changed as well. She had to stay overnight in the hospital, and she said that the nursing care was just unbelievable. But when it came to picking up her prescriptions, she said, there's a cost to her prescriptions. President Joe Biden's administration, through the Inflation Reduction Act, implemented some of the most significant prescription drug pricing reforms in decades, especially focused on Medicare. And Trump's executive order partly overturned what Biden already had in place, and it affected drug prices. So drug price, so like for my mother in particular, she now has to, like, medications that had become down to $30 or free, she now has to pay for them. So some of the key Biden era pricing reforms through the Inflation Reduction Act included the Medicare drug negotiation price and the $35 insulin cap. There's also $1,000 annual cap for your out-of-pocket prescription costs. And this is significant because I know I'm using my mother as the example, her co-pays a lot of times, because she gets a copay reimbursement through her retirement funding. There's a certain amount that's allocated to her per year, and she can go through that in like 6 or 7 months. The Reduction Act really helped her. And now that it's taken away, I see that she's submitting receipts again more and more. And again, we're already at May, and she's already about to be out of a lot of those funds because now she has to pay for medications again. What Trump's executive order did was it rescinded parts of the Inflation Reduction Act, specifically the negotiation framework that Biden had established. The elimination of the inflation penalty removed protection like the insulin prices cap or the $2,000 pocket limits. The bottom line is Biden's plan focused on structured phase negotiations and patient protection, while Trump's order aims for faster price slashing through international pricing indexing, but it removes some of the systemic focus safeguards that Biden had put in place. It kind of goes back to what I always say and why I encourage everyone to really do your research, your due diligence, being in the right rooms, and being in rooms like the Nurse Shift Change Rally. I kind of shift back to that to give you an understanding of why we're marching and why we're even organizing this rally. So things like that, drug costs, like how are we being affected? How are our marginalized communities being affected, or our underrepresented communities being affected by these type of implementations? So this is why it's important, because it could be your mom, it could be you, it could be your parents, it could be your kids. So it's important that you stand up and you have a voice and stand with us. Another way that you can have a voice is by choosing you. In my LinkedIn newsletter today, I talked about how nurses can come together. And I'll give you an example. I'm going to give you, and I'm actually just going to read right from my own newsletters. And it is segue right into our conversation about the Health and Wealth Expo, because today I want to give you some insight on what's going to take place at the Health and Wealth Expo and why it's important for you to be in these type of rooms. So I'm just going to just read right from my LinkedIn newsletter, because it talks about why nurses need to be in the room, right? So why nurses and healthcare professionals really can't afford to miss this summit. It talks about burnout. It talks about financial literacy. And let me go ahead and read it because I said I would. I mean, we're the backbone, right, of the profession. And we're often left out of tools to build long-term health and wealth. 62% of nurses report high stress due to financial instability. Over 40% live paycheck to paycheck, according to recent studies. And then only 28% of nurses feel confident about their retirement planning. All things we're going to be talking about at the summit, and showing you the steps to take so that you can be empowered and so that you can have impact and make impact, not only on yourself, but be able to leave a legacy. Because remember, our theme is it starts with you. And this is how you start to leave a legacy. You have to start getting into the right rooms. The other point that I make is that Black and Latino women make up a growing portion of the healthcare workforce, yet consistently underrepresented in leadership, funding access, and business ownership. And I've talked about this in other podcasts as well, and I've given statistics. So you guys know I'm not just, making these things up. And because of this, and again, I just read this, that you can head over to my LinkedIn newsletter, see Dr. Lendra James, Nurturing Nurses from Burnout to Breakthroughs. And you can read my newsletter from today. But again, the overarching concern is that why are we financially illiterate? Not all of us, but why don't we have the financial education? And I think part of it is because now here's comes my opinion, right? We're not taught. We're not taught about the finance. And I've said this before too, because sometimes I feel like I'm repeating myself, but we're not. But this is why the Health and Wealth Expo began. So the Health and Wealth Expo truly, truly, truly began as I wrote a book. And during my book launch, we got into discussions surrounding health and wealth and bias in healthcare. And because I had experienced a level of bias in healthcare, it drove me to write my book. And during that book launch, the conversations that were being had, it made me realize that I'm not the only one experiencing these things, right? Because a lot of times we feel like we're alone and we feel like it's just us when it's not. It's not just us. We need to be able to understand and know that, guess what? We can make a difference, and we can make a difference in our own way. We can make a difference in our community. And that difference does not have to be in the traditional setting. Now, let me be clear. Of course, we need nurses in the traditional setting. And I would never want to discourage anyone from being where you feel home is for you, or being where you feel like being where you feel comfortable, right? The idea is to make sure while you're on this journey, you are taking advantage of rooms like the Health and Wealth Expo. Why? Because of the type of discussions that we're going to be talking about. You're not going to get that at your everyday nursing summit. Everyday nursing summits are not just talking about entrepreneurship. They're not talking about financial education the way we're going to be talking about it. We're going to be talking about artificial intelligence, using technology. We're going to be talking about launching and scaling. We're going to be talking about building generational wealth, giving you that financial education, and having those type of conversations that you may not have had at the dinner table. And something Bilal Little said, he's going to be a speaker as well, and something that he said makes so much sense. There's so much information out there now that can no longer be an excuse. We can no longer say, well, you know what? No one taught me this, or this wasn't a conversation that we had at the dinner table, or they didn't teach me this in nursing school. Because there's so much information out there that we need to be educating ourselves. And rooms like the Health and Wealth Expo is exactly how we do it. And listen, don't take my word for it. I want you to hear from a few of the speakers and even one past attendee for what you need to know about the Health and Wealth Expo and why it's important to be in these rooms, or the type of things that you're going to learn. I want you to take a listen and listen, leave it in the comments. Tell me what you think, and join us May 15th and 16th in Mount Laurel, New Jersey. Join us at the Health and Wealth Expo. You can register at healthandwealthexpolive.com. We still have one-day passes available, so you can register. Head on over and register at healthandwealthexpolive.com. I was speaking with a nurse practitioner today, and I was telling her about the summit, and she said her response was, when I became a nurse practitioner, she's like, I never intended on working for someone, which she said, my plan is to have my own practice. She said, so I love what you're doing for nurses. And, the Health and Wealth Expo, I'm a nurse. So of course my target audience is nurses and healthcare professionals. But I always like to put a reminder out there that anyone can really gain from attending the Health and Wealth Expo. We attend conferences, and we attend 2 and 3 day conferences, and we make time for that, right? And when it comes to building something that's going to be your own, we should make time for the same thing, right? Not just going to a conference because our job is sending us. Go to a conference because this is going to be personal and professional development for me, right? Like for you, right? Because it starts with you. And that's our theme for the Health and Wealth Expo. It's really about it starting with you. It starts with you building a legacy of health and wealth. And how you do that is through That's Rosie. Don't mind her. Um, but how you do that is by getting into the right rooms, right? When you look at the traditional career paths for healthcare, for nursing, they're just no longer enough for nurses. When you look at the burnout, when you look at the layoffs, when you look at limited advancement, so you have to ask yourself, what is the advancement? And it depends on what your goals are. If your goals are to be a CNO, then that's your ceiling, right? Your advancement depends on where you're looking to go, but then that's your ceiling. What if you can advance or invest in yourself where there wasn't a ceiling? And entrepreneurship does just that for you. If your goal is to work in a cath lab, then that's your ceiling. Nothing wrong with any of these things that I'm naming. Please, please, please understand that. It just really depends on what your ceiling is. And if you're happy where you are, I want you to stay where you are. But I just want to open up the opportunities that we're not taught, right? We're not taught about. There's a whole new world out there with things that we can do. There's a whole other platforms that we can really tap into. And this is how the Health and Wealth Expo Live Summit is designed. It's really designed to be able to give you the opportunity to tap into those platforms. And I'll give you an example. We have a suite of basically services that you would need to start your own business. So there's going to be workshops on business plans. There are going to be workshops on marketing. There's going to be workshops with an HR consultant. And you guys may have heard me talk about these things before, but it's just to help you keep in mind what's all going to be there. Like, it's almost like an at your service summit. And again, our summit is rooted in addressing that leadership support, addressing that mentorship, and giving you that guidance that you're going to need to be able to be successful. And that's what it's about. So you're not coming just to be inspired and hear other people's stories or hear other people tell you, like what you need to do or what they did. You're coming to be educated and empowered and actually leave with something. And I'm going to get into a little bit about the pitch competition because I don't think I've talked about that a lot. And the pitch competition is your chance to win money to invest in your business, basically, right? And the thing about the pitch competition, we're really looking at three things. So we're focusing on you knowing your numbers with your business. That's going to be a huge part of it. So knowing your numbers and what problem are you solving? So if you're going to be, your registration is your entry to the pitch competition. But what problem are you solving with your business? So that's what we want to know. And for those people who have registered, you are going to receive this information of what the pitch competition looks like, what the criteria is going to be, and what the judges are going to be looking at. So basically, knowing your numbers, what problem are you solving in your community, and then just how you're able to present it. So your presentation. So that's the criteria of what we're going to be looking at for the pitch competition. And it's really that simple. And like I said, you can win a prize towards your business, towards resources, whether it's payroll, whether it's marketing, whether it's a piece of equipment that you've been wanting to get for your business. This is your opportunity to do just that. So I'm going to stop there for now, just to give you some thought. I call it a summit, but it's really truly an exclusive opportunity. It's an exclusive opportunity for you to learn from industry experts who are going to be pouring into you, showing you how they went from zero to six figures, right? And removing that ceiling. Because a lot of us, we place a ceiling on us and we don't realize, and it's no one's fault. It's just that we're just not taught certain things in healthcare. We're just not taught certain things in a traditional setting. So it's no one's fault, but it's removing that ceiling. So we want to remove that ceiling and give you extreme opportunity and just believe in yourself and bet in yourself. You have to, because that's how you're going to remove that ceiling. So I'm going to leave you there for now. You can register at healthandwealthexpolive.com. Again, that is Health and Wealth Expo Live.com. And Hopefully I'll see you at the summit. But there's so many other ways you can have passive income streams, which is why the Health and Wealth Expo Live Summit is so important. And I'm excited about your conversation. I can't wait to sit there and just be taking notes myself. So I so appreciate it. I mean, and I want to hear from you. Why do you think people should come?
I think they should make investments in themselves. At the end of the day, like, you spend time in a lot of areas of your life of constant detraction. What I mean by that is people are constantly depleting you of resources. Come have a beverage here, come hang out to dinner here, and there's not a lot of contribution to your bottom line. And in many cases, someone's always soliciting something from you as well, right? Like, buy this, like you're marketed to nonstop. But no one ever flips the conversation on its head and lead with the whole world. And I've been thinking about this a lot lately, even biblically. It's like success is completely opposite of what everyone else is doing. It's not even it's not even a question. It's not up for debate. You can literally sit there and identify whatever is hard, whatever is difficult. The people who do it, they somehow tend to have some different experience in life. Rather, you look at, let's just go health. If you decide to juice and you decide to do the difficult things of not just going after your taste buds for sugar and salt, which have basically been infiltrated in our entire diet, which also lead to Alzheimer's and mental disease and all of this other stuff. And you spend the time protecting your vital organs. That's less time that you'll have with cholesterol issues and all of these other aspects that are ailments in our community, right? That discipline or discernment, you can call them, right, both almost, right? Both the discipline to do what's necessary and the discernment to say that doesn't serve me are critical. And you need to identify things that actually serve you. In the case of this particular health and wellness conference, like, think about the relationships that you could connect with. You start to look online, people are joining run clubs. There's more fruitful ways to spend your time. And I think this conversation is vital. But then the fact that you're tying in a critical aspect of society, which is finances, you can't miss, because money is ingrained and ingratiated in everything that we do. There is nothing that you can't do without having to deal or interact with it. So to not have a good command of the subject matter is on you. And you're likely having financial troubles or struggles because of yourself. And anytime that I am trying to commit to
just the power packedness of this expo as well, from like speakers, just like you said, talking about wealth and health, and just thinking about people telling their truth, their stories, having authors, and the entrepreneurship though. I'm just wrapping my head around that, just the empowerment just within that. I mean, just having people talking about building a brand, like, girl, you covering it all.
Right.
One-stop shop.
Right.
If you haven't registered, like, you need to get in where you can fit in, because it's just going to be dynamic speakers, and just, I know just the networking is going to be out of this world, because people are doing amazing things and have that spirit of wanting to connect and share the game secrets.
We all know, and if you don't know, now you know, that marketing should be a big part of your executive plan, your business plan. If you are not marketing, you are not getting customers. If you're not getting customers, you're not in business. You're not in business, then guess what? You're not making any income. And that's the reason why we are in business, correct? To not only make income, but to make an impact in people's lives. So marketing is huge. Now, you can have the best product, you can have the best service, but if you don't know how to market it, nobody cares. So what I'm going to be doing is I'm going to take you and give you like the foundations of online marketing. And what I'm saying about that, like, in today's world, everything is digital. Okay, people are looking at their phones. We got 3 seconds of attention span and everything like that. So you have to have a strong online presence in order to be successful. Trust me, what you're not doing, your competitors are. And that's why they're winning, and that's why you're not. So what I'm going to be talking about is ensuring that your business can be easily found online, setting up your success for the right digital tools, leveraging word of mouth marketing through customer reviews. Now that's what you want. That's huge, because if a customer loves what you're doing for them, they're going to share it, just like anything else. Think about it. You go to a restaurant, the food is delicious. What do? You tell your friends and family. You go to a movie, you love it. What do? You tell your friends and family. It's the same thing about your business.
At the time, Lendra was like, listen, I see that you want to grow, and these are the areas that I can help you grow in. As a new nurse, I was thrown into charge roles, leadership roles, and I just was like, Lendra, how do I navigate this? How do I direct other people? Again, reached out to Lendra again so I found that in mentorship, and just really having that comfortable space to share those experiences and those anxieties. You shouldn't be a nurse at 26 and then retire at 55. Like, that's not the goal, to be bedside. That's not where most people should be heading. Taking that initiative and starting your own business, or going into a lane that you feel like is less demanding and it gives you more time to really be with yourself, work on your mental health, which is so important, because we can't give ourselves to others if our mental health is not where. Great and insightful. So appreciate you, Lendra. Thank you for bringing all these wonderful speakers and everyone together and giving us this information.
I hope you enjoyed listening to and just getting a little taste, a little dose of what's going to be happening these next 2 incredible days. So May 15th and 16th is going to be absolutely incredible. Listen, I hope to see you in the room one of the days. If you weren't fortunate enough to get the all access pass or our standard access pass, we still have 1-day passes available, and I hope to see you in the room. We're going to have incredible vendors. The vendor marketplace is just going to be absolutely phenomenal. The summit is blending health, wealth, and wellness. So our vendors are doing the same. And one of our vendors is amazing. She has jewelry that actually helps the women who are going through menopause, like how I just had a flash just a little while ago. I don't know if you guys noticed the sweat that was on my head a little while ago, especially under these lights. She has jewelry that helps with hormone levels and like the flash. Oh my gosh. So I actually can't wait to really experience some of that. So again, this is just going to be such an amazing experience. Definitely stay tuned. I'm actually going to be going live with one of the speakers today I'm going to be going live with Brooke Kruger. Actually, she is with American IV Association, and Brooke they're actually bringing an attorney who's going to be giving legal insights on how to start your IV hydration business, how to start your medical practice, how to start your healthcare practice, I should say, so that you can make sure that you're setting yourself up for success. And that's what it is, right? So a lot of times we enter these programs and the program shows us how to start a business, but no one's teaching us how to actually scale the business. And that's where the secret sauce becomes. And that's why it's important to make sure that you have systems and strategies in place to not only start a business for your personal well-being, and so that you can scale and be rich in life, right? And something that I wrote on my Mentorship Monday this week, and I'm actually going to close off with this, is how a lot of times I know we talk about generational wealth, we talk about health, and we talk about wealth, and all of these things are important. And understanding that it really, really, truly starts with you choosing you, right? And what do I mean by that? What I mean is you have to make sure that you're in the right rooms and find peace with it. And when you find peace, whether it's through prayer, whether it's through believing in your faith, believing in a higher power, trusting in God, trusting and knowing that He is going to make a path for you. When you start doing that, when you start really believing and just having that inner peace in the decisions that you make, you can't be any richer. And having such mental clarity can really, really start to help you to make choices that are going to benefit not only you, but your children and your children's children. And this is why it starts with you. And this is why I think it's poetic that we are hosting the Health and Wealth Expo, not only in Mental Health Awareness Month, but also during Nurses Month, right? It's really poetic to be able to bring this full circle. So again, I hope you guys can join us May 15th and 16th in Mount Laurel, New Jersey. Head over to healthandwealthexpolive.com, and I will see you at the summit. Until next time, make sure that you stay inspired, stay educated, and stay empowered.